Welcome to another program of Health Matters, a presentation by the Ministry of Health. And on our program, we're talking about leprosy or Hansen disease. Joining me, we've got Dr. Heather Wilson, Director of Public Health, the Public Health Skin Clinic, the Leprosy Program, and we've got also Dr. Bernadine, doctor attached to the same program. Doctors, welcome to our program. We're just observing, in recent times, World Leprosy Day, and it's glad to have you on our program. Tell us very quickly, Doctor, this one is to Dr. Wilson, a bit about leprosy. What is leprosy for those who might not know?
Okay, thank you for having us. So leprosy, what is leprosy? Leprosy is something that a lot of people are afraid of. Like when they hear the word, they are afraid of it because they remember all the text in the ancient text of the Bible. That's Jesus healed a leper and how they were treated back then. But leprosy is simply a mildly infectious disease that is caused by a bacteria. So you persons pick up this bacteria by being exposed to someone who is carrying it in their nostrils. And not only that, that person who becomes infected with this bacteria called Mycobacterium leprae, they are in contact with this infected person for a very long time. So for an extended period. So we're not talking about hours, days, months. It can be many years. All right. So basically, it's a mildly infectious disease. It is not an affliction from God. It is not a curse. It is not hereditary, meaning that you cannot get leprosy from your parents. It is not transmitted from a mother who has leprosy to her unborn child, and it is not spread by sexual contact. So this is the information that is very important that we have to share every year because John public believe that it's one of those things that when you get the diagnosis is the beginning of the end.
I guess in the days gone by, they were actually doing a lot of physical and social distancing when they were heard.
Exactly, but this was a very drastic social distancing because persons in those days were considered lower. They were considered lower than, for example, a slave. So they tended to be isolated outside of a city, placed at the roadside, and they were doomed to beg. So they were really treated
And then
unfairly.
as you see some pictures, old pictures of some form of deformity that lends to that negative, situation that people would want to shun or scorn persons living with leprosy.
Very true. Because of how leprosy, the you call it the evolution of the disease. Once it is not recognized early, you are more prone to have all of these complications. And unfortunately, these complications causes a lot of morbidity, and that person is now have these they have to deal with their physical disability, meaning that people are seeing it. So once people see the characteristic clawing that they tend to they tend to say, okay, this person should not be around me. All right. So hence these persons are shunned by society. And another thing I would like to say is that in the olden days, leprosy, the word leprosy was used as a catch-all phrase for every disease that was around at that time. So research has now been showing that most of the diseases that they would have had back then, for example, the mildew that they had and the plague, would have been those diseases and not the leprosy that we know today. Because leprosy we know today actually was discovered later, as you know, in 1873 by the Norwegian doctor, Dr. Amor Hansen, hence the name Hansen's disease too.
We bring in Dr. Fu here to give us what are some of these symptoms that people can expect if they might have Hansen disease or leprosy.
Okay. Because the bacterium, Mycobacterium leprae, affects mainly the skin, the peripheral nerves, and the mucous membranes, the disease generally manifests with skin lesions, nerve affectations such as weakness in the arm or the legs, muscle wasting, pain, numbness. Sometimes the patient may refer tingling sensation, a burning sensation. This is due to the nerve affectation. Also, the mucous membranes, meaning the inner lining of your nostrils, your mouth, those can be affected as well. You can have lesions there, swelling. The swelling and the lesions in the lining of the nose can cause blockage, and so the person may have difficulty breathing. And of course, as the disease progresses and there's no treatment, the blockage to the nostrils gets worse. One of the main symptoms, or some of the first to appear, are the skin lesions. And these skin lesions may come looking like latta. Latta tends to appear as a white spot. It may look like ringworm or even mad bumps, as we would call it, which generally are due to allergies. So it comes in various forms. And this is something that we have to bear in mind because we want to keep an eye out for it. We don't want to wait or to miss it and have it diagnosed till in the later stage when the nerve damage is being done already, because the main reason why there is stigma to this disease is due to the nerve damage, which causes the disfigurement.
Before we continue with stigma and so forth, we'll want to take a break. When we come back, we'll talk some more of the symptoms and some of the other underlying issues that comes with leprosy. So stay with us. We'll be right back after these messages.
No. Yup. No. Yup. No. Yup. No. Yup. No. Yup. No. Yup.
Before the break, we were talking about these signs and symptoms, and I'd like Dr. Fu to continue along that line.
Yeah, so the skin lesions generally do not itch. So that is one thing that we have to bear in mind. And over time, as the disease progresses, there can be hair loss on these lesions. The sensitivity as well on the lesions can be lost. So there may be a gradual, what you call paresthesia and then anesthesia. And the lesions can also be painful when they become swollen and red. They can be very painful, along with the nerve pain affecting mainly the limbs. There's also hair loss to the eyebrows and eyelashes, which some patients can experience, especially those that are severely affected, meaning they have the multibacillary leprosy or the lepromatous leprosy. So those are some of the things that we have to look for. And also, these patients can have complications. So there may be other symptoms accompanying the main symptoms, such as fever, pains all over the body, joint pains, swelling to the hands and feet, especially the fingers or toes. And ulcers, of course, can appear in the severely affected patients. So those are just some of the main symptoms that we want to let the public know about to
So,
look for.
Dr. Wilson, your main program is at the Breakdown location, which is in the compound of the Palms. People will go there and they meet you. What's the process? How is a person diagnosed with leprosy or Hansen disease?
Okay, so yes, we are located in the Palms compound on Bergdam. So first of all, I should add that the Public Health Skin Clinic runs a general dermatology program. So during these skin clinics, right, where we go to 16 clinics every month, during these skin clinics, we check for leprosy because a person, unfortunately, a lot of persons are not educated about leprosy as yet. They may hear, but maybe not remember. And so basically, they come in and they think they have a spot, and we look and we check because we have a very low threshold for suspicion. So they come in for their skin appointments. Now we are encouraging patients to call the number because of the pandemic. They come in, we look at them, and if we suspect that spot, we start to do our thing. So we, depending on what they have, we count the spots. We do our sensitivity test. We tell them that they have to do a skin smear. So at the Palms compound, we have a medical technologist who is skilled in taking samples for the slit skin smear. So in this smear, she takes a little bit of tissue from the ear, the earlobes, the elbows, and the knees. And sometimes she may take samples from a rash, a suspicious rash. And then we don't have to wait on the slit skin smear's result to start the treatment because once these symptoms that Dr. Fu spoke about, if there's numbness, hair loss, we start the treatment immediately. The treatment is called multi-drug therapy, meaning there are more than one drug. So we have 3 drugs that has been proven by the WHO to cure leprosy completely.
So there's a cure.
Yes, there is a cure, but there is a little thing there. You have to come early. All right. So everyone will be cured if they use the treatment as specified. For example, if you have the mild type of leprosy, your treatment is 6 months. If you have the severe type, 12 months. So you have to be compliant. And depending on the stage that you are in and you're finished, you're cured. But then, as you know, there are complications that unfortunately some patients battle. But that is why it's very important that the program train medical doctors and nurses every year for them to suspect this disease.
Right. You did mention complications, and Dr. Fu also did mention some, but there's some very others. I mean, she mentioned about the eyebrows and so forth. But it's interesting to note that there's wreak havoc on the eyes. From things to glaucoma and so forth. Amazingly, things like kidney failure, Dr. Fu.
Yes, kidney failure is a rare complication of the disease. We've not been seeing much of that. Mainly, like I said, the affectations of the skin and the nerves. But yes, that can be one of the complications.
One thing people want to ask, I'm sure, they say there's a cure, and you mentioned, phases of the disease. Is this something a patient will take for forever, for the rest of their lives?
You're talking about the treatment?
The treatment, yeah.
So, no, the treatment is long because, knowing that leprosy is a chronic disease, it's very chronic, meaning it's going to be, you have to take treatment for a very long time. So sometimes patients are very afraid that they have to take the tablets for a very long time. The tablets have side effects, but, we caution them. It's not any side effects that will obviously harm them too much. But these are side effects that once you complete the treatment, it goes away. Or if the side effect is, for example, an allergy to one of the drug, we substitute it because there are alternative regimens to the specified multi-drug therapy that WHO says that we should use. Yes, so it's curable once diagnosed early. All right, so the thing is, we don't want to see patients coming in 5 years after they have gotten a spot. We want a patient to come in as soon as they get the spot, because one thing we tell patients and they come in, once this spot is not getting better with field ointment, with your clotrimazole, with your Forderm, whatever you buy, come in. All right, come in, let us check. And when we check and we're not sure, we place you on watch for 3 months and we keep following you up. And then, because we've had cases where patients were on watch and then they are now on treatment because we kept, close contact with them.
So many stories with
Lots.
Leprosy. I mean, a special hospital was built decades ago. Stories told that that particular hospital was the storage for patients, not only in Guyana, but for the entire Caribbean. And that gave birth to the stigma and possibly discrimination. In today's world, 2021, 2022, what are some of the patients' response to the treatment, and what are they facing, or when they have to face the communities?
Well, first of all, I want to say that this stigma starts even from on diagnosis. The patients of themselves feel a way about this disease.
There's some stigma.
They're fearful. They are worried. They're wondering, what's going to happen to them. So, and it takes time to reassure them that this is curable.
Mm-hmm.
And once they are compliant with the treatment, there shouldn't be any complications. Now, of course, they need support, family support or a friend. And some of them don't have that courage to tell their family or friends. They may tell one or two persons that are very close to them,
mm-hmm.
or nobody. So because of the fear of being discriminated, those that have let their relatives know or someone else know about the disease, they have faced discrimination. They have been looked at in a different way, shunned. Some have been told negative stuff to their face. And so it's all over. The stigma continues. Even persons that we talk to about leprosy, that they don't have leprosy, but we talk to them about it, they react negatively, because I think that comes mainly because they don't know about the disease. They don't know that it's curable. So they just know that it's a disease they heard of from the Bible, and the disfiguring images that they were told about. That's what they know about the disease. So we want to get over the message or the information about leprosy for them to better understand it.
Dr. Wilson, as we wrap up this segment, what would be your message to John Public? You have 25 seconds.
So, John Public, understand leprosy and show kindness. Mm-hmm. Understand the disease. Knowledge is power. It is curable. The treatment is free of cost. You call 226-0679 to make your appointment at the skin clinic if you have any suspicious spot.
And I'm quite sure we'll be having scrolling at the bottom of your screen the 16 locations where outreaches are held. We were talking to two of the doctors attached to the skin clinic leprosy program there. And we now have a patient. Because of privacy and confidentiality, we won't be able to, those who are viewing, to see the person's feature. And for those who are listening, there will be no names and location, as the case may be. So welcome to our program. Glad that you can be with us to share your story. So you could tell our audience how it all came about. What prompted you to go and seek medical attention?
Well, it started in 2015. Um, to be exact, on Valentine's Day the 14th. It it come up like bumps and like itching. Then it went away. Then it came back up like a week after. And they prompted me to go to the hospital. I was in Georgia Hospital Clinic like for a year. And they did a, a biopsy, which in they find leprosy and they transfer me to the clinic. And
So when you heard leprosy, how you felt?
they don't, like, like people can scan you. They can.
Did you feel that was the end of the game, giving up, or you knew you wanted to go after it?
You feel like if it's the end of the road, but because you know that you have children you have to live for, and so you have to press on.
So they send you over to the clinic and break down what happened there.
When I went there, I started the treatment right away. I had doctors that spoke to me, that encouraged me, and I did my 1 year treatment. But there was still a lot of questions. People tried like react to you.
So that's home. So now, obviously, the folks at home would have seen some changes.
Yeah.
How did you treat that now? Did you tell them, or they start ask questions first?
Well, when I first diagnosed it, I tell my parents, I tell my children, but some of the family members start to react, give me negative reaction. But my parents, they stood by me, and my kids, they stood by me through it until now.
Friends and other,
Well, for friends,
you were working at the time.
Yes.
So what happened there now? Because they would also see some changes.
yes, at work, I get some negative vibes, and then during the hospitalization, with the pain and the steady reaction, I had to be medical unfit for work. So they had a negative vibes there too.
And so you continue treatment. Well, what was it like to be taking these tablets? How many tablets you had to take? I mean, that could have been a burden too, right?
Yeah.
At first, it was a whole lot of tablets at first. Because you had the treatment tablets, and then you had the prednisolone, then you had the painkillers, and you gotta stay on the painkillers, you gotta stay on the preds. But it is a challenge, but you have to go through it if you want see success, you have to.
What were some of the other challenges you face? Especially people who would have noticed, neighbors and other people.
You had a lot of negative vibes.
What were some of the words you would hear?
Yeah.
You have HIV.
That's a new one. Yeah.
No, because
No, because people don't really know about
Right.
it, and they're accustomed to seeing one sickness with your skin break out. So when you telling people now that it's not that, it's this, it's leprosy, and the first thing they want to know if it's catchable, if they're gonna get it. I know you have to explain to them. You have to be around somebody years before you get it.
A rough time to get a hug, right?
yeah.
Yeah.
Yeah. But interestingly, what would you like to tell people out there about this disease?
First of all, yes, Dr. will say from the time you notice the bumps and the marks and the scratches, and it's from the time you start with the itching, I would advise you to come down to the Palms Clinic.
People there?
Yes.
Yes, there is.
Yeah.
They have people that can talk to you. You get your treatment if you don't wait till it's too late.
before
Till
it's
it's
too late. Thank you very much. Thank you very much for coming to share your story. And I hope maybe in another 50 years, Valentine's from now, you could come back and tell us your story, right? Thanks a lot for being with us. And thanks for being a part of our program. As you would have been observing, two particular days, World Leprosy Day and World Neglected Tropical Diseases Day. We thank you for being with us. Do join us again next time. And until that time, stay safe, be well.